Hi, my name is Mayri Mendez, and today I will be talking about the Unit 5 at 13. Medical Practitioners 1. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, including the General Medical Councils or registered, in order to practice. A doctor who treats patients as opposite to one who only does research is called a clinician. A doctor who provides private care for patients is known as a general practitioner (GP) or family doctor. GP is usually work in group practice. Large group practice work in building called a health center. Note: in British English the verb is split practice and the noun is split practice. B. Specialists. A specialist doctor, for example, pediatrician, general work in hospital. However, those who work outside the NHS, providing private health care, may have consulted on-site at hospital. For example, in the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians. Respectively, in Britain, male surgeons are obvious and Mr. and females as Miss. So Dr. Smith is a physician and Miss Smith is a surgeon. A cardiologist is a specialist in the science of the heart and circulations of cartilage. A geriatrician is a specialist in the science of early patients or geriatrics. An anesthetist is a specialist in anesthesia. Note: names of specialists usually end in ology. Names of specialists usually end in ology is the name of the specialty ends in cs. The name of a specialist ends is Asian. There are some exceptions, e.g., anesthesia and anesthetist. C. Choosing a specialty. Jill Moss has just graduated from medical school and is thinking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrician because I like working with children. I certainly prefer to work with children than say elderly patients, so I don't fancy geriatrics. I was never very interested in the late anatomy, so the surgical specialist like neurosurgery don't really up. You have to be good with your hands. We don't did a problem for me. I've assisted operations several times. I've even done some minor ops by myself. But surgeons have to able to do the same thing again and again without breathing more, like training of good arteries and so on. I don't think that would be a problem for me, but they need to make decisions fast. I'm not too good at the. I like to have time to think, which means surgery is probably not right for me. Note: the collection good with infallo by announced his good these children. The collection good is a follow by the ing from gerund of the verb or by nouns. She is good at explaining procedures. She is good at explanations. Ah, practicantes. En Gran Bretaña, los médicos, también conocidos como médicos, deben ser certificados, tener un título universitario en medicina, también deben estar registrados, incluidos en la lista del Consejo Médico General o registro. Para poder ejercer, un médico que trata a los pacientes, a diferencia de uno solo investiga, se llama clínico. Un médico que brinda atención primaria a los pacientes se conoce como médico GP o médico de familia. Los médicos suelen trabajar en una práctica de grupo. Las prácticas de grupos más grandes trabajan en un edificio llamado centro de salud. Nota: en inglés británico, el verbo se deletra práctica y el sustantivo se deletrea práctica. Especialistas o especialidades. Las médicos especialistas, por ejemplo, los pediatras suelen trabajar en hospitales. Sin embargo, aquellos que trabajan fuera del NHS, brindando atención médica privada, pueden tener salas de consulta fuera del hospital, por ejemplo, en la famosa calle Harley en Londres. Las dos ramas principales de la medicina son la cirugía y la medicina interna, y los médicos que practican estas ramas se denominan cirujanos y médicos respectivamente. En Gran Bretaña, a los cirujanos masculinos se les llama señor y a las mujeres señora, por lo que el doctor Smith es médico de la señora Smith en cirugía. Un cardiólogo se especializa en enfermedades del corazón y la circulación o cardiología de enfermedades. Un geriatra es un especialista en los pacientes de edad avanzada o geriatría. Un anestesista se especializa en anestésicos. Nota: los nombres de las especialidades suelen terminar en ología. Los nombres de los especialistas suelen terminar en ólogo. Y si el nombre de la especialidad termina en ICS, el nombre del especialista termina en ICIAN. Algunas expresiones: anestésico y anestesista. C. Elegir una especialidad. Jill Martins se acaba de graduar de la Facultad de Medicina y habla sobre su futuro. Todavía no he decidido en qué especializarme. Necesito más experiencia antes de decidirme, pero me atrae bastante la idea de pediatría porque me gusta trabajar con niños. Sin duda, preferiría trabajar con niños que, digamos, con pacientes ancianos, así que no me gusta la geriatría. Nunca me interesó mucho la anatomía detallada, por lo que las especialidades quirúrgicas como la neurocirugía no me atraen mucho. Tienes que ser bueno en tus manos, lo que creo que sea un problema para mí. He asistido en operaciones varias veces e incluso he hecho algunas operaciones menores de mi cuenta, pero las cirugías tienen que ser capaces de hacer lo mismo una vez y otra vez sin aburrirse, como ligar arterias cortadas y demás. No creo que eso sea un problema para mí, pero necesito tomar decisiones rápido y no soy muy bueno con eso. Me gusta tener tiempo para pensar, lo que significa que la cirugía probablemente no sea adecuada para él. Nota, la colocación, bueno, va seguida de un sustantivo. Es bueno que los niños la va seguida de forma ing, gerundio de un verbo o un sustantivo. Es buena para explicar procedimientos. Ella es buena en sus explicaciones. Continuing with the exercise. Write a sentence to describe the work of the specialist in each branch of medicine. Look at the opposite to help you. 1. Dermatology. A dermatologist specialist in the size of the skin. 2. Rheumatology is a specialist in the size of the joints. Traumatology is a specialist in accident and emergency medicine. Pediatrics is a specialist in the science affections children. Obstetrics is a specialist in managing pregnancies. 5.2. Complete the table with words from A, B, and C opposite and relate forms. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, noun, person, and noun, adjective, or thing. Verb, especially, noun, specialists, and special. Practice, practitioner and practice. Consult, consultant and consultation. Assist, assistant as assistant. Graduate, graduate, graduation. Qualify and qualification. 5.3. Find prepositions in C opposite that be used to make word combination with the words in the box. They use the correct form from the word to complete the sentence. Good, interesting, special, and word. A pathologist especially in diagnosing disease through examination cells and tissue. 2. A pediatrician must enjoy working with children. 3. An oncologist is interested in the diagnosis and treatment of cancer. 4. A physiatrist must be good at counseling. 5. A neurosurgeon must be good with her hands. 5.4. Make word combination using a word from each box. Two words can be used twice. Look at A, B, and C opposite to help you. Consulting rooms, general practitioner, group practice, health center, internal medicine, and surgical specialists. Medical practitioner 2. A staff, hospital staff, the people who work in any type of workplace, including hospital and college staff. The medical staff in British hospital belong to one of four main groups. A pre-registration house office (PRHO) or house office is a newly graduate doctor in the first year of graduate training. After a year, she becomes a registered medical practitioner in the current system of training, the foundation program. The name for the desk junior doctor in Foundation Year 1 Doctor FJ1, a senior house of CSHO in the second year of progress training. The title is Down Foundation Year 2 Doctor, but the old term Senior House of and SHO are still used, especially registered SPR is a doctor who has completed the foundation program and is training in one medical specialty. There are also some non-training registered doctors who have completed their training but do not with the specialty yet. And consultant is a fully qualified specialist. There may also be say associate specialist, senior doctor who do not wish to become consultant. In addition, there is a less on one medical or clinical doctor who is responsible for all the medical staff, medical teams, consultant physicians and surgeons are responsible for the specific number of patients in the hospital. Each consult has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consult not only the doctors but also physiotherapists and other allied health professionals. When patients enter on the admitted to the hospital, they are usually seen first by one of the junior doctors on the ward where they will receive treatment of care. The junior doctor creates them, tests the medical history and examination, then sometimes later the registrar asks the persons and make all the investigations for this. For example, X-rays or ECG make professional diagnosis and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the work from the first time on the regular work rounds when the managers of the patient is discussed with the registrant consults at the sites when the patient is ready to be discharged. On the ward round, the consultant is accompanied by me, time, and nurse, and they visit all the patients in the consultant care shift. Junior doctors now normally work in shift, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are there free until 7 and the next day after a week they change for different shifts. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is the work from 9 a.m. to 5 p.m. every day, and the make turns to be on call available to return to hospital is necessary. From 5 p.m. to 9 a.m. the next day, days on call are set out in rota or list of names, times, doctor, and call carry radio pager of bladder a device which makes a noise when the someone is trying to contact them. Médicos 2. Personal, personal de hospital. Las personas que trabajan en cualquier tipo de centro de trabajo, incluidos los del hospital, se denominan personal médico en un hospital británico. Pertenece a uno de los cuatro grupos generales. Está un oficial de casa de preregistro, que es el PRHO, u oficial de casa, que es un médico recién graduado en el primer año de una formación de posgrado. El programa de la fundación da nombre a estos médicos como junior en el médico 1 de la fundación, que es el FY1. El, un oficial superior de casa, SHO, está ese segundo año de la formación de posgrado y que se titula médico del año 2 de la fundación, FY2. Para los términos anteriores son oficial senior de la casa y SHO todavía se utilizan hoy en día. También está un registrador especialista, que es un médico que se completa el programa de fundación y se está formado en unas especialidades médicas. También hay algunos registradores sin formación. También está un consultor especialista totalmente calificado. También puede haber algunos especialistas asociados, médicos superiores, que no deseen convertirse en consultores. Además, hay menos un director clínico que es responsable de todo el personal médico. La vez, equipos médicos. Los médicos consultores y los cirujanos son responsabilidades de un número específico de pacientes en el hospital. Cada consultor tiene un equipo de médicos junior para ayudar y cuidar a los pacientes. En muchos hospitales existen equipos multidisciplinarios que contienen no solo médicos, sino también fisioterapeutas y otros profesionales de la salud. Cuando los pacientes se integran al hospital o son muy admitidos a él, generalmente son admitidos primero por uno de los médicos auxiliares en la sala de donde recibirán tratamiento y atención. El médico subalterno los atiende, toda su historia al médico y los examina y así sucesivamente. El consultor suele ver las admisiones, personas que se han ingresado recientemente en la sala, por primera vez una de las rondas regulares de la sala. Cuando se analiza el manejo de los pacientes en el registrado, los consultores también deciden cuándo el paciente está listo para ser dado de alta enviado a casa. En la ronda de la sala, el consultor está acompañado por el equipo y la enfermera y visitan a todos los pacientes en su cargo. Turnos. Los médicos jóvenes ahora trabajan normalmente en turnos, lo que significa que normalmente trabajan 8 horas todos los días, por ejemplo, de 7 de la mañana a 3 de la noche, y luego trabajan libres hasta las 7 de la mañana, hasta el siguiente día, hasta la siguiente semana, cambian de turnos, por ejemplo, de 3 de la tarde a 11 de la noche, de 11 de la noche a 7 de la mañana. El sistema alternativo es trabajar 9 de la mañana a 5 de la tarde todos los días y hacer turnos para estar de guardia. Disponible para regresar al hospital es necesario de 5 de la noche a 9 de la mañana del día siguiente. Los días de guardia se establecen una lista de nombres y horas. Los médicos de guardia llevan un localizador de radio o beeper, un dispositivo que se hace un ruido cuando alguien se intenta comunicar con ellos. Activities. 6.1. Make word combination using word from each box. Look at A, B, and C opposite help you. Associate especially house office. On call provisional diagnosis. Radio pager war room. March the description 1.5 with the job titles. Look at A and B opposite to help you. 1. Dr. Graham has been pediatrician for 8 years and is responsible to training the children admitted to ward system. C. Consultant. Dr. Stewart has just started the second year of the foundation program. is a CHO. Dr. Singh has started his training as a surgeon, a specialty registrar. Dr. Phillips has just graduated and is working at a large hospital in Birmingham. PRHO or of House Officer. Dr. Miller is a chair for the medical staff in the Brigham Hospital. Medical Director. 6.3 are the following stems through a false when reason for your main absence in A, B, and C opposites. A medical graduate becomes registered 2 years after graduation. False. The extent of training doctors in Britain is California Foundation Program. True. The name Senior House Office is a longer used Britain. False. The consul is usually the first doctor to see new patients. False. 5. When working in shift, all doctors test turn to be alcohol. False. Complete the test of PRHO, describe the job. Look at ABC opposite to help you. When I get to work the first time I do is talk to house officers who was a duty during the last shift to find out in their leave and there have been any new admissions. Then I Henry see the charge nurse. He tells me if there is anything that needs to be done urgent, such as intravenous lines to put or take down. Later in the morning, I clerk any new patients with Besley involves taking a story on the Tuesday and Friday morning. The consult does her role, and I have to make sure I'm complete of the date for the patients. After that, there are usually lots of things to do like wearing up requests from the for glove test and so on. In the afternoon, I have to prepare for the any patients who are to be discharged the next day. They are usually happy to again home. And then, of course, there are the lectures on tutors in the foundation program on Monday and Wednesday. Thank you.